Hello everyone, my name is Dr. Jared Skillings. I am a board-certified clinical health psychologist, and I am very pleased that you joined us today for today's presentation on military depression. First, let's review what depression is. Depression is definitely something that needs our attention. It is both a medical and psychological problem, and it's something that affects a service member's attitude and health. What depression is not. Depression is not just a bad mood or normal adjustment. It's also not less important than real medical disease. The symptoms of major depression include emotional, physical, and cognitive or thinking symptoms. For example, on the emotional side, you may find that your mood is sad or grouchy. You may lose pleasure in activities that you used to enjoy or feel excessively guilty. On the physical side, you may have weight changes or changes in your appetite. You may have struggles with your sleep and be either really physically slowed down or too keyed up. You may feel tired frequently. And in regards to your thinking, you may struggle to make decisions or concentrate and maybe even have suicidal thoughts. Not everyone has all of these symptoms, but you must have at least 5 of them in order to qualify for a diagnosis of major depression. For service members, as many as 15% who returned from Operation Iraqi Freedom or Enduring Freedom were diagnosed as being clinically depressed. Unfortunately, only 50% were treated for these symptoms. This suggests that there is still a significant stigma for service members to avoid admitting they're depressed or getting treatment for it. In order to find out if you are depressed, there are 2 depression questions we should start with. Over the last 2 weeks, have you been bothered by the following problems? Yes or no? Number 1, feeling down, depressed, or hopeless. Number 2, having little interest or pleasure in doing things. If you answered yes to either one of these questions, you should complete the depression quiz, which we have attached or linked to this presentation. In the next slide of this presentation, you will see the scores from this depression quiz. The depression quiz is called the PHQ-9, and the scores range from 0 to 27, and depending on your score, that will tell you how severe the depression symptoms you have are. In order to decide whether you need treatment, you can look at your PHQ-9 score and then look at the diagnosis that you might qualify for and what the recommendations are for treatment. Please remember, these are recommendations only. You must see your psychologist or doctor in order to get an official diagnosis and make a recommendation for treatment. The kinds of options for treatment include medications, which are often used in combination with talk therapy. These medications are called antidepressants. Talk therapy, also called psychotherapy or counseling, can also be beneficial. The 2 kinds of talk therapy that are the most supported by research are called cognitive behavioral therapy and interpersonal therapy. Lastly, what can you do to help yourself if you're depressed? This is brief treatment that you can do for yourself, and it uses the word speak to help you remember. S is for schedule. You can schedule activities and tasks for the day. That will help keep you on track. P is for pleasurable activities. Try to do more healthy activities that you enjoy, maybe 1 or 2 per day. E is for exercise. Try to exercise for 30 minutes at a time, at least 3 times per week. A is for assertiveness. Try to stand up for yourself by expressing your needs and wishes to other people. Lastly, K is for kind thoughts. Try to think healthy thoughts about yourself and other people. Don't be so hard on yourself, and try to remember the positive traits you have. Lastly, how family and friends can help. There's a technique called the bathe technique. The letters in the word bathe help family and friends remember how to help someone else who's depressed. B stands for background, so they can ask, what's going on in your life right now? A stands for affect, which is another word for emotion. They can ask, how do you feel about that? T stands for trouble. What's troubling you or bothering you the most? H stands for handling. How are you handling that? What are you doing to cope? And E stands for empathy. That must be very difficult. It sounds like you're having a hard time. These are all good comments and questions to ask someone who is experiencing depression. If you would like more information about military depression, you are welcome to click on this link to view a 15-minute video that the Army produced about depression and suicide. It's very helpful information and might provide you additional resources and methods for coping. Thank you very much for listening to this presentation. We hope it was helpful. Have a terrific day.